Alright, ladies and gentlemen, the topics of discussion today are osteosarcoma and giant cell tumor of bone. One of these lesions is frankly malignant, that is osteosarcoma, and giant cell tumor of bone not so, although it does require surgical treatment as well. Now, osteosarcoma presents usually, or rather I should say predominantly, in the younger age group, before or around adolescence, and the most common locations include the metaphyseal regions of long bones of extremities. Okay, and of the most common ones, the majority of cases involve, or rather I'd say a large number of cases involve the knee joint. Okay, so they generally present as painful masses. Somebody may come to you saying that he's got pain in the knee, and then a radiograph is performed, and then it has got a characteristic appearance where you got to know that it is an aggressive lesion, and further workup, a possible biopsy, etc. is done. Now, this is a gross example of osteosarcoma. I said before that these are tumors. These tumors generally, predominantly, present in a younger age group, but it doesn't mean that they do not present in other age groups. The books say that it has got a bimodal distribution. There is a second peak that occurs in older adults as well, which may have certain predisposing conditions like bone infarcts or any previous history of radiation therapy. Now, there are certain genes that are involved in the pathogenesis, one of which is in RB, which is a cell cycle regulator. You must have read about cell cycle regulators in general pathology. And the other one is TP53, and a few others as well, but I guess if you can remember 2 to 3, one of them is RB, another one is TP53. These are easier to remember, but MDM2 and CDK4 are the other ones that are involved, mutations of which may be involved or may lead to osteosarcomas. Okay, now this is a gross picture of an osteosarcoma. This whole of this is tumor. Now remember that this tumor it's a highly malignant tumor, and it infiltrates into the bone marrow of the bone, the marrow space, and it may, this is the margin of the tumor here, this may infiltrate into the surrounding joint as well, and it also infiltrates the cortex of the bone, as you can see here. Now what happens is that it infiltrates the cortex of the bone, it lifts the periosteum up, and this is how it characteristically presents on a radiograph, and that presentation is known as the Codman's triangle. You can see this tumor is going down here into the marrow spaces. Here it has not invaded the joint space yet, but it can, and here it is going outside of the cortex of this bone. Osteosarcomas can metastasize. Lung is the most common site of metastasis, but there are other sites as well. Now, osteosarcomas on histology look like somewhat like this. Now remember that osteosarcoma histologically for a postgraduate student might be of multiple different types. These may be mentioned in your books, textbooks as well. This is a histological picture of a conventional osteosarcoma, but there may be other varieties as well. Chondroblastic osteosarcomas are there, giant cell osteosarcomas are there, telangiectatic, small cell, etc., so forth, so on and so forth. There are low-grade varieties, there are high-grade varieties. They may be classified as the ones involving the cortex, medulla, etc. So this is the typical picture of the most common variety, and you should remember this structure, the one I'm pointing with the cursor right now. This one here, these are typically described as having a lace-like configuration, and this is known as the osteoid, and this is the neoplastic bone that the tumor deposits, the tumor cells deposit. This is the main diagnostic point of an osteosarcoma histology. These are, you can see, are the tumor cells. Some of them are mononuclear, some of them, like this one, are multinucleated. Okay, these are all tumor cells. There may be bizarre nuclear forms as well, but the main diagnostic feature, remember, is this osteoid here, 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 and here. This is these two are the mitotic activities. Examples of some which there's a high mitotic activity going on in these tumors usually. So these are bizarre mitotic activity forms, the atypical mitotic figures you can see here, this one and this one, and this one is a mononuclear tumor cell, multinucleated tumor cells. There might be bizarre forms, and this is the osteoid. So this is the typical histology of an osteosarcoma. Now next tumor for a very brief discussion today is giant cell tumor of bone. Remember, giant cell tumors of bone on gross, they are generally brown cystic kind of masses. They may also erode the bone, but they are still less aggressive as compared to the osteosarcomas. Okay, now this is the typical histology of a giant cell tumor of the bone. Now see, this is one multinucleated giant cell, this is one multinucleated giant cell. These are described typically as osteoclast-like joint cells, which may contain 50 to 100 nuclei even, and these mononuclear cells are actually the tumor cells. So we typically describe it as sheets of mononuclear cells with interspersed multinucleated osteoclast type giant cells, which is the typical morphology of a giant cell tumor of bone. Now giant cell tumor of bone, I said, are less aggressive as compared to a malignant osteosarcoma. Their most common site is also around the knee joint. You can read the mutations, etc., that can be detected in these tumors. They can recur, they need surgical treatment as well. The new or the good thing about osteosarcomas is that although they are very aggressive, but they can be partially controlled with neoadjuvant chemotherapies and then with surgical treatments. And giant cell tumors, they generally, according to books, are curetaged, but they are not usually fatal. Okay, this is the good thing about giant cell tumor of the bone. Osteosarcoma can really be a fatal tumor. Okay, so this is briefly about osteosarcoma and giant cell tumor morphologies, both gross and microscopic. These are the slides. You can write from these slides. Okay, and this is the material source. Thanks a lot. Let me know if you have any